day, everyone. My name is Dr. Rambau. I am from Mommy Bear Mommy and Child Clinic, and also I work as a general practitioner at Dr. Mashudu and Medical Partners. Today I'm going to talk to you about endometriosis. Sounds familiar, right? Yes, because this is another condition that is very common amongst women. So endometriosis is a condition whereby your normal endometrial mucosa or endometrial cells, they go and implant themselves anywhere else other than in the uterine cavity. This is where you're gonna find endometrial cells outside the endometrial or the uterine cavity where they're supposed to be. What can cause one to develop this endometriosis? So there are a group of people that we consider to be high risk people. These are people who have got a family history of endometriosis. It can be that your mother or your grandmother had endometriosis, so you become a high risk of developing endometriosis. The second risk is early menarche. Early menarche is if you have started your periods early. Early could be anything from 8, 9 years, 10 years, 11. We consider that to be early menarche. The other thing is short menstrual cycle. These are people who go on their periods in less than 27 days. The normal menstrual period, we consider it to be 28 days. So anyone who can go back on their periods even after 18 days, 25 days, we consider that as short menstrual cycle. The other thing is having long periods and also having heavy bleeding. So long periods is having your period anything for more than 7 days. So in average, a woman is supposed to go on their periods anything from 3 to 5 days to 7 days. We consider that to be normal. But if you are going on your periods for more than 7 days, we consider that as long periods and can put you at risk of developing endometriosis. The other thing that causes one to be at risk of developing endometriosis, it is delayed childbearing or having a child when you are older, having your firstborn after the age of 35. It means all this time you are going on your periods and your uterus or your body is not getting break from the bleeding and everything. It increases your risk of developing endometriosis. The other thing is when you have had any operation in the uterus, it could be for any reason. It also develops, it also causes you to develop endometriosis. Other illnesses that include iron deficiency, people who struggle with iron deficiency, anemia, as well as things like hypoxia. So that also increases your risk of getting endometriosis. So how do you know that I've got endometriosis? I've heard a lot of ladies saying, I've got endometriosis. How do we come to that conclusion? Number one, you will have what we call dysmenorrhea. Dysmenorrhea, it's very painful periods. Actually, normal periods are not supposed to hurt. You will feel a little bit of crampy, but once it becomes painful, there is a problem. The second thing is having heavy and irregular bleeding. By heavy bleeding, we are talking about too much blood, clots, and this bleeding, you can bleed this week, you skip a week and you are bleeding again the other week. We consider that to be irregular. The other thing is pelvic pain. As I said, normal periods are not supposed to hurt. If you have pain on your pelvis area, that can be an indication that there is endometriosis. The other thing is lower back and lower abdominal pain. Why does it also affect the lower back? Because our uterus is sitting right here. So whatever that can affect your frontal area where the uterus is and everything can also radiate to the back, can also affect your back. That's why even when you're on your periods, you will feel like you've got something on your back because they work together. So that can be a sign that you are also developing endometriosis. Other things include bloating, constipation, diarrhea, where you have when they touch you on your abdomen, it's very, very painful. When you are having intercourse, it becomes very painful because there is problem with your uterus. So these are some of the signs that you have to look at. It's not normal to experience pain as a woman, either during intercourse or when you are going on your periods. As soon as you go through that, make sure that you see a healthcare practitioner. So endometriosis, if it's not treated, if it's not managed, there are complications that comes with it. And some of these complications include infertility or subfertility. Infertility means completely not being able to have children, and subfertility means there was an underlying condition, or there were chances that you could have children, but because you have got this condition, it contributes to delaying or making it difficult for you to have a child. The other thing is chronic pelvic pain. Once you start feeling pain, this pain becomes recurrent, and it means every day of your life you have to depend on pain medication. The other complication here, it includes a problem with your genital or with your uterine structures or your anatomy. They become problem with that, because endometriosis, like I said, it's going to be cells that are implanting themselves in the wrong places or where they are not supposed to be. So how do you get to investigate or to the diagnosis of endometriosis? They can diagnose endometriosis using an ultrasound or an MRI. Also, it can be diagnosed using what we call laparoscopy. Laparoscopy means they are going to put you in theater, they are going to put some cameras inside, open and see what structures or what cells or where exactly these cells have implanted themselves. They are also going to do a biopsy, cut some of those cells, send them through to the lab and do what we call histology, so that they are 100% sure of which specific cells are there. We would also need to do full blood count, a urine test, as well as cervical tests or cervical cultures, because sometimes we can think it's endometriosis just to find that there is an infection in the cervix, or you can say it's an endometriosis just to find that there is urinary tract infection. So treatment is available for this condition. This condition can be treated by simply taking oral contraceptives. Yes, nice and easy and affordable. You can take oral contraceptives. You can also take something that we call gonadotropin releasing hormone analogs. These are pills that have got gonadotropin releasing hormone analogs that will help you with this condition of endometriosis. Also, the progesterone agents, they also help treat this condition. They can also be treated by surgical approach, whereby they put you to theater and they remove all the cells where these cells have implanted themselves. So like I always say, ladies, don't stay at home, don't sit when things are not going well. Always go to see your doctor, your midwife, your nurse, your healthcare practitioners, and talk to them about your symptoms. Let's see if you will not be assisted when it's early before we get to the complications. Thank you and be blessed.